My guest today is Ondřej Dostál from the Czech Republic, a member of the European Parliament and member of the European Christian Political Party. We have on our table today a very important subject of public health. Recently, in December 2025, the European Commission unveiled the EU Cardiovascular Health Plan, followed by the European Parliament's draft report in March 2026 on Europe's Beating Cancer Plan. And these are the two documents which today are the two flagship initiatives of the EU institutions on public health. We know that healthcare is a nation-state competence. Public health is where the EU is coordinating important policies. Now, knowing these two documents, which are being discussed in the European Parliament and going to be voted on and discussed in Sant, which is the Public Health Committee of the European Parliament, where, Ondřej, you are a member. Knowing these documents, how timely do you think and how appropriate, relevant do you think are these two policy recommendations or these two documents are in light of the dire health conditions of the European continent and of European societies?
Well, good morning, Márton. Good morning, people. Today we will speak about public health, what is good for your heart, what is good for the constitutions of national states, and also what is in accordance with Kantian principles of personal autonomy. And I hope it will not be too boring. First of all, the boring part. The European situation now is of a failed federalization project, and in health it is very nicely seen. We have many nice programs in health, like against cancer or against cardiovascular diseases. But the problem is that, as you rightly said, national states are doing the healthcare systems, they are doing the pricing, they are doing the reimbursements. So basically there's not a lot of what EU can actually do. But still we have the money. So we basically misspend them on various like NGOs and research projects, but we don't own any research facilities, so we give them out basically. So it is all nice and everybody is struggling if we are not misspending this money. The problem is that if EU cannot actually treat people, they are trying to invent some political ways how to tax them. So they would do the right thing and not the wrong thing. And this is exactly what we don't want, because EU is a peace and prosperity project, and it is not my good mother who would tell me not to drink too much alcohol. Yeah. So this is the constitutional beginning. Should we continue to the health part?
Sure, absolutely. Even more so that the numbers are shocking. Like even for non-health experts like myself, to read that in the European Union, over half of the population is overweight, and there are annually 300,000 deaths related to alcohol, and the problem is even bigger when we come to children at the age of 7, 8, 9. We see that obesity and being overweight is a problem in the new generation, which is related to diet and to basically what they eat and what they consume. Is there any room for regulating that, or is that a problem at all that the EU should address?
Well, I will say some things which are not in the cardiovascular plan, but which you need to know. Well, we are fat because we are stressed. We are sitting in the offices and eating. Of course, it is our work, especially here in European Parliament. But this is something everybody can improve by having sort of work-life balance, or at least having some exercise during the workplace, and also trying to find some jobs which are not destructive for your health, but they're actually productive for you and for the society. And for this, EU can do a great thing to remove unnecessary regulations, so we will have fewer compliance officers and lawyers on managements of whatever the regulation is doing, and we have more people who are actually productive and who make sensible work. First thing. Another thing. EU cannot speak about some big determinants of child health because they happened during COVID, and EU did a lot to make it worse, and the countries also. The kids during 2020-2029 were prohibited from exercising in the schools. They were prohibited of doing amateur sports even outside in the countryside, which was nonsense from the point of view of epidemiology. Because if you are racing on mountain bikes or playing football or something
it doesn't impact the wider
anything.
society.
Especially if then you have the shops open, so you go shopping and go to metro, to subway and so on, and then the kids cannot just go away and have sports. So they are depressed. They didn't meet their friends. They started to do these things on the cell phone, and they grew several kilograms in average, which is terrible. It is a terrible statistics. In average, adding a few kilograms to 10 years olds. This is a disaster looming 20 years later when all these people will have much higher probability.
Problems, yes.
When the EU cannot say, well, we were very dumb that we allowed these things to happen, and we even ordered them, and we brought all these fake specialists who told that this will save us from COVID. It didn't.
Yes.
So this is the first part. But okay, this is over, and we need to overcome this. That means that we need to spend money on sensible things, like giving some cash for the local coaches to buy some balls and for football and play like on the championship like now. We need some heroes, so the politicians should also not be too fat if we can help it somehow and show that it is possible.
Lead by example.
Lead by example, exactly. Yes. It is also the food, as you rightly mentioned. We are eating terrible things. Processed foods, like some of the sausages which don't even contain meat, but whatever, and they are very unhealthy. They are palm oil things.
Processed meats, palm oil, added sugar, and all the alcohol, energy drinks.
Energy drinks. This is a good killer, especially for the kids.
Absolutely.
Yeah.
Absolutely.
And many people have a great idea, very stupid one, that they have a drink of vodka and they have like the energy drink, and this is complete
together.
Killer.
Yeah.
Completely
alcohol
bad.
Combined with energy drinks is yes.
So what we can do, we could teach the people that this is a wrong thing. We should help them to understand. They should not eat badly. They should not let their kids spending the time in front of a screen and take them outside as the fathers did for ages. But we don't. Because it is not even EU competence, but EU can spend money wisely to educate
the population.
To take really care that every single child has a child doctor. So if you go to doctor, the doctor has enough time and tells you, well, you are a bit fat, so you should do this or that. I'm not nasty to you, but it would be better for our health.
But being overweight and obesity is a problem, and science also underpins this argument. There's so much scientific evidence what the real drivers are in obesity and in cardiovascular diseases. So it's shocking that when somebody reads this EU health plan, it's as if it's completely detached of science itself.
That's right.
It seems to be some kind of a very typical EU approach where they like to kind of interfere and impose. That seems to be the way forward.
And this is what we need. We need doctors from practical life, like Alena Dernerová, member of our party, by the way, who is a child neurologist. And she always tells to the kids who have like neurological, psychological problems who come to her office, do you know, young man, what is brain rot? Yes, of course, I know what brain rot is. Well, this is what you have. Yes, so please stop scrolling on the cell phone, and you will be much better. You will be okay. And Alena can speak very nicely about this because she is like 70 years old doctor, very experienced. And this is what we need instead of the EU blub we always get.
There was a report and a survey that was published by the IMF, and they have come up with a proposal to tax certain products, certain consumer products, in proportion to the harm that they cause. Now, in the European Union, we talk a lot about taxing tobacco, which is very clearly evident, and I think everybody knows that tobacco is harmful. I mean, that's when you ask anybody on the street, everybody will say, well, tobacco is the main killer and the main cause of every health issue, but nobody knows that all these things that we have also mentioned are equally bad. Now, the IMF, what the IMF is suggesting is that all the products, based on how much harm they cause, should be taxed in some kind of proportion to the harm that they cause. Would this be a way forward? Taxation or the means of fiscal policy?
Not at all, because first and preeminently, EU should not tax people's behavior. EU is an intergovernmental organization which should get some money from the governments and not meddle in tax policy. It was not created for this. It is not a federation.
It's not an EU competence. It's not an EU competence to start with. Yeah, but there seems to be talk about it, that if the EU wants to be taken seriously, it has to have some kind of own funds, not only funds of member states that it has to ask for all the time.
No, it should not get its own funds, because it is not a state, it is not a federation, it is an intergovernmental organization, and it is perfectly proper that the states allocate some money which they send to Brussels for some common activities, but EU should not have any right to impose new taxes or new payments which are hidden taxes, like the ETS, for instance, or the tobacco tax, which will then serve for some projects like war or Green Deal or whatever, which the Brussels, without sufficient oversight from the people, tries to initiate. Of course, EU is out of money because we did lots of stupid things. So we owe lots of money, which we send away, and we will never get them back. So they need to tax somebody somehow to get the money. And this is exactly where I say no. Taxation is the matter of the national states, and EU should not meddle into this. We will have the debate at the state level, if it is a good idea actually to tax unhealthy things. Well, it would be tobacco. It would be sitting in the office at the IMF, because it is very unhealthy. It is stressful. I don't think they exercise a lot. So we should tax them for adding some costs from civilization diseases to the health system. No, I'm joking. But if we want to play a good mother to our adult citizens,
tell them what to do.
Tell them what to do via taxation. We should tax lots of things. How they eat. We had these dystopic examples even quarter century back when I studied health law at St. Louis University, when they predicted there will be an AI which will tell you, well, you are trying to buy pizza. No, you already had enough of unhealthy foods today. You are not buying pizza. Sorry, I'm not doing this payment. Or I'm telling it to the tax office that they would create a prohibitive tax for this purchase. No. I am father of my kids. I impose chat control on them because they cannot use the stupid social networks.
Responsible citizens is what we have to educate and not punish through tax.
And until they are 18, they have to listen to my very dictatorial way, how I tell them they need to be healthy and not to spend all the time on the cell phones. When they are 18, they will be mature citizens and they can do whatever they want with their health. But I'm adult and I don't want the state to tell me if I eat more too much sugar, because I played competition beach volleyball. I don't play it on competition level, but I still sport a lot. When I go to the court and spend 8 hours there, and then I have Coca-Cola or a beer, well, it is quite okay because the balance is fine. Yeah. Of course, I could have something more healthy than beer, but well, it is my decision. Sorry.
You are Czech. Yeah, you have an excuse.
I'm Czech. I have an excuse. Yes. Or if I work in woods or on a construction site, well, I expend lots of energy and I need to take in sugar. So when somebody taxes sugar, well, it is stupid because the people need it. Of course, if I sit in the office, I cannot eat all the time. I'm not trying not to eat all the time. But this is for every adult person to decide. The state should give the right information, perhaps through doctors, because doctors know these things better than the regulators. But the citizens need to decide.
So we can basically conclude by saying that if the EU wants to be taken seriously as an actor in tackling the main causes of cardiovascular cardiovascular diseases, it should maybe address the main cause of the problem, and most certainly it should not impose taxes, for sure, because it is not a state, if I understand your arguments correctly. Its main role should be in educating people and use maybe science as a basis for addressing the main drivers of the disease and bring in the balance into people's life, because there seems to be a great imbalance.
EU should support the health systems of member states. Of doing better job and educate their citizens better, but it is up to the member states. Common research is good in some areas, some coordination is good, but the decision is on the member states.
With the member states.
This is the constitutional part. Secondly, we need to do good research. That means tackle all the problems, not only like tobacco, but also the unhealthy lifestyle and sweet drinks and things like this via education. Which brings me to the last Kantian point, because we are autonomous beings. And we, as autonomous beings, can decide what we do with our body. We can destroy it. We can keep it healthy until 100 years. We can do whatever we want. And the state can help us, can advise us, but we will decide. This is my point.
This is a wonderful way of wrapping it all up, and I'm sure that we will be still discussing this topic as it is on the table of the European Parliament, and it will be in the Sant Committee. I'm sure that as this file evolves, we will revisit it in this studio. Thank you very much.
That's right. Thank you very much.
For Ondřej Dostál for being with us today, and thank you very much for your attention. Bye-bye.